Welcome to today's video about the 10 silent stroke signs you should never ignore. Did you know that a stroke may not always present clear symptoms? A stroke, also known as a cerebrovascular accident, CVA, is one of the leading causes of death in the USA. Each year, over 700,000 people experience strokes, with the majority, around 87%, due to a blockage in an artery that prevents blood from reaching the brain. It's crucial to seek immediate medical attention when this occurs because any delay increases the risk of permanent damage as the affected brain area can die without oxygen. While many are familiar with the classic symptoms of a stroke, a reminder is always useful. A cerebrovascular accident has distinct symptoms that appear suddenly, such as skin sensitivity, numbness in the extremities and face, slurred speech, one-sided body weakness, imbalance, and difficulty swallowing. To detect a stroke quickly and easily, remember the acronym FAST. F for face, ask the person to smile. And if only one side of their face responds or appears paralyzed, it might indicate a problem. A for arm, ask them to lift both arms and see if one drifts downward. S for speech, ask them to repeat a simple sentence. And if they can't or their speech is slurred, it could be a stroke. T for time, if you see any of these signs, call 911 immediately, as time is crucial in minimizing damage. Now that we've refreshed your memory on the classic stroke symptoms, let's talk about silent strokes. According to some studies, silent strokes are the majority of stroke cases in the USA, meaning many people have strokes without realizing it and therefore don't seek help. Being informed is vital because untreated strokes are a major cause of dementia. Here are 10 often overlooked signs of a silent stroke. Sudden drowsiness is one sign. This type of drowsiness appears unexpectedly without prior warning or a clear cause and tends to persist, sometimes causing the person to fall asleep abruptly during a conversation. Unlike typical drowsiness that results from fatigue or lack of sleep, stroke-related drowsiness comes out of nowhere and can interfere significantly with daily activities. Vomiting and nausea are another pair of symptoms to watch for. Stroke-related nausea and vomiting often occur without stomach pain or diarrhea and are usually paired with dizziness or vertigo. This type of nausea appears suddenly and does not have the common gastrointestinal causes, making it a red flag for a potential stroke. Seizures can also be an indication of a stroke. If someone without a history of epilepsy suddenly experiences a seizure, it could be a sign of a stroke. Seizures in the context of a stroke might be due to the sudden interruption of normal brain activity, and it's essential to seek medical attention immediately if this occurs. Hiccups, although seemingly benign, can be another symptom. Prolonged hiccups lasting hours or days, especially when accompanied by other stroke symptoms like numbness or weakness on one side of the body, could indicate a stroke. These hiccups are not the usual kind that resolve quickly but persistently interfere with normal activities. Pain is a less recognized but important symptom. Stroke-related pain can be episodic, transient, or persistent and might feel like a burning sensation. It can affect the face, a limb, or one side of the body. This type of pain is often overlooked because it does not fit the typical stroke symptom profile but should be taken seriously if it arises suddenly. Fainting is another common symptom that is often overlooked. Many conditions can cause fainting, such as malnutrition or low blood pressure. But if someone at risk for stroke faints, they should see a doctor immediately. Fainting can occur because the brain is temporarily deprived of oxygen, and this symptom should not be ignored, especially in individuals with other stroke risk factors. Memory lapses are a prevalent symptom associated with strokes. Sudden inability to remember parts of your day or how you got somewhere can indicate a stroke. Memory issues, particularly if they arise suddenly and without prior history of memory problems, should prompt an immediate medical evaluation. An even more concerning manifestation is when there's a sudden inability to create new memories following the onset of the stroke. Dizziness is a symptom that many often overlook. Strokes can trigger dizziness, and any unexplained dizziness should be taken seriously. This dizziness is not the kind that comes from spinning too quickly or standing up too fast. It's a more persistent sensation that can interfere with balance and normal functioning. Disorientation is another critical sign. Difficulty in orienting yourself in terms of time, place, or memory can be a sign of a stroke and requires immediate medical attention. This kind of disorientation often results in a loss of short-term memory and can significantly impair daily functioning. Reports suggest that some individuals have suffered from multiple mini-strokes, intensifying symptoms and eventually leading to dementia. Neuropsychiatric manifestations can also be a sign of a stroke. Sudden psychotic episodes without any prior history can be a symptom of a stroke. These episodes often arise suddenly and without any prior warning, and typically the affected individuals don't have prior medical conditions or histories that would justify such episodes. Always stay vigilant for such unexpected changes in behavior or mental state. Understanding these symptoms helps in recognizing silent strokes, which, if untreated, can lead to dementia. Strokes are often caused by high blood pressure, heart diseases, especially arrhythmias like atrial fibrillation, diabetes, high cholesterol, obesity, a sedentary lifestyle, and smoking. To treat a stroke, immediate action is required to stop it, manage its aftereffects, and prevent future occurrences. Treatments might include using aspirin, managing hypertension, treating arrhythmias, and controlling cholesterol levels. Surgical interventions like angioplasty may also be necessary. High blood pressure is one of the primary and well-known causes of a stroke. Having high blood pressure increases the risk of experiencing a stroke by 2 to 4 times. Another prevalent cause is heart diseases, particularly arrhythmias. The arrhythmia most associated with strokes is atrial fibrillation, which can amplify the risk of a stroke by up to 6 times. However, it's not just arrhythmias that cause strokes. Several other conditions can lead to this disease. Having a weak heart, a dilated heart, or even blood clots are significant causes of strokes. Smoking significantly increases the risk of experiencing a stroke. For smokers, the risk of a stroke doubles, and the risk of a hemorrhagic stroke quadruples. This heightened risk arises from the inflammation caused by smoking and the increased potential for aneurysms. Surprisingly, diabetes is another common cause. Elevated blood sugar levels can weaken the blood vessels throughout our body. High cholesterol is also a leading cause of strokes. Similarly, obesity and a sedentary lifestyle play crucial roles. Both are associated with hypertension, heart diseases, and other symptoms previously highlighted. When addressing a stroke, both the stage and symptoms play a crucial role in determining the treatment. The primary step involves stopping the stroke, followed by addressing its aftereffects and finally taking measures to prevent future occurrences. Each situation varies, with silent strokes presenting unique challenges. It's imperative for the doctor to weigh the risks and benefits of each treatment option. In terms of preventing subsequent silent strokes, proactive measures make a significant difference. The key lies in controlling the associated risk factors. By managing these risk factors alone, it's possible to prevent 9 out of every 10 stroke cases. Some possible treatments include using aspirin immediately after a stroke, but if you suspect you are experiencing a stroke, consult a doctor before using aspirin. The medication helps to prevent the recurrence of strokes and reduces the severity if the patient has additional strokes. Treating hypertension is also an excellent way to help prevent strokes. Controlling blood pressure is a very important factor. Additionally, identifying and treating arrhythmias is essential. As highlighted earlier, arrhythmia ranks among the top causes of strokes, so by getting proper treatment for arrhythmia and improving from this condition, your chances of having a stroke again drop dramatically. Anticoagulant medications are often prescribed in such scenarios, proving beneficial. Moreover, managing cholesterol is crucial. Remember, lower levels of LDL, the bad cholesterol, coupled with higher levels of HDL, the good cholesterol, are desirable for optimal health. For those who've experienced a blockage, surgical interventions such as angioplasty or cleaning the affected site might be recommended. Ultimately, the most effective way to alleviate concerns about stroke is to cultivate healthier habits. Leading a lighter, healthier, and more active life helps you maintain a healthier body with fewer risk factors. In other words, maintain a healthy diet, engage in regular physical activities, and continuously monitor and manage your symptoms under the guidance of a healthcare professional. If you found this video helpful, please like, share, and subscribe to our channel. Don't forget to hit the notification bell for updates on new content. We'd love to hear from you. Did you know about these silent stroke signs? Share your thoughts in the comments. Thank you for watching, and see you in the next video.